Well, August is National Breastfeeding Month. So to help us raise awareness, we invited Kelsey McKenna to Midday. She is a registered nurse and international board-certified lactation consultant with St. David's Georgetown Hospital. That's a mouthful, but that's because she knows a lot, right? So we're going to ask you, how beneficial is breastfeeding for the baby and the mom?
Yes, the benefits for breastfeeding last the whole lifetime. So for mom, immediately there's going to be less postpartum bleeding, which is of course beneficial. And then long-term, less risk for diabetes type 2, ovarian and breast cancers, and heart disease. For baby, it's the perfect first food for baby, but the immune benefits don't stop at the colostrum, which is that first milk. The immune benefits last the entire journey throughout the breastfeeding experience and actually peak at the beginning and the end with immune benefit levels. So,
what's the guidance for how long a new mom should breastfeed?
Yeah, so the CDC is going to recommend 1 year, but the World Health Organization, which is the more worldly view, and being internationally certified, that's what I would go based on, is 2 years or as long as the mom and baby are finding it beneficial and functional. So 2 years or longer would actually be recommended, and the actual breastfeeding cessation age for the world is 2 to 5. So it's very interesting.
Okay, and so what are some of the misconceptions about breastfeeding that you can break right here?
Yeah, so the media sometimes doesn't do the best job depicting like the nipple shields, lactation consultants, latch problems. Those do come up. Baby is brand new and overstimulated, and then mom's also learning whether it's the first or the third time. So just keeping in mind that it's a journey, that you're wanting to keep a positive outlook, but remember that there's going to be milestones that we're reaching, new problems that come up. Definitely reach out to outpatient lactation resources. LactationNetwork.com can give you that way to filter your insurance to see who's covered and can come to your home or in clinic. Mom support groups have been shown to be the best thing for the moms to hear the other problems.
And sure, to know that it may not happen right away, I think will take the pressure off some new moms. I know I didn't know, oh my gosh, what's going to happen?
Yeah.
At what point should new moms call someone like you, a lactation consultant specialist, to come in to help?
Yeah, so if your hospital offers lactation consultants, I would recommend requesting it if it's not already a standard there. And then outpatient lactation can be set up while you're in the hospital for like a week out, just so you can kind of know that that's there, and if there's any new problems that come up, you have someone coming to your home or a clinic visit to be able to address that and just not feel alone. WIC gives great resources, as well as those mom support groups are so important because they get to hear the other problems and navigate those with the other moms.
And so what do you tell new moms?
I tell them that there's going to be a process of the milk coming in, and we go through that. We go through what a great latch looks like and feels like. Latching shouldn't hurt. Sometimes that first minute can be a little pinchy, but that's because the nipple is empty and needs to fill. After that, it should be a smooth latch. So making sure that that looks good and that they feel what that should feel like, then they can do that at home and replicate that.
Kelsey, we're running out of time, but I don't want to forget, there are breastfeeding toys. They didn't have this when I was breastfeeding. Can you show them the breastfeeding necklace, and how does that help a baby and the mom?
Yeah, so once the babies get old enough to be distractible, they're going to be pulling your hair or, tugging on other things. So we want them to be tugging on this. So this is a breastfeeding necklace. There's also like little tabs you can put on the shirt, baby can play with, but just something else to distract. And then if baby really pulls on it, there's going to be that safety feature for mom. So no risk there. So they're a new and up and coming thing, but the other parts of the world have been using them for some time, and they're medical grade silicone, so they're safe for baby.
Well, Kelsey McKenna, thank you so much for telling us all about that, showing us that necklace, and for your time, of course.
Yes, of course. My pleasure. Thank you.